In this interview, we hear from Katie. She's a 23-year-old nurse working on a Med-Surg floor in the Hudson Valley region of New York. She shares what her experience a few years post-grad is like. Hi, Katie. Thanks so much for joining
Hi,
me today.
thank
Hi.
you.
So you are a Med-Surg nurse and a young, lively one at that. And I've interviewed a couple of other nurses who are a little bit further into their 20s. So I am so excited to get the not fresh out of college, but a couple years into career perspective from you. Can you tell me a little bit about what you went to school for or how you even got interested in nursing?
Yeah, so I originally wanted to be a teacher. And when I started looking at schools, I was looking at education. And then I don't even really know when the switch happened, but I remember talking to one of my family friends, and she was going through the program that I actually ended up going to, and she just loved it, and she talked about it all the time. And she just kind of like inspired me, I guess, to
Okay.
go into nursing. So I went to a 4-year college right out of high school, and I got into the nursing program.
Okay.
So went through the 4 years, did all my clinicals, then I took the NCLEX, which is the licensure exam for nursing that everyone has to take to um, become a registered nurse. So once you take it, you can get licensed in any state.
Okay.
But the licenses are state specific. So even though you've taken the test, you then have to go. I know with New York, I had to take a infection control class and a mandated reporter class, but they're all online. I think a lot of state jobs require those too anyway.
Hmm.
Um, but so I could practice in any state if I were to go get my license for that state.
Okay, cool. And now I know you did a 4-year program. Is there a significant advantage to maybe doing a 2-year program?
BSN is just the degree. There's bachelor's and associates. The
Oh,
associates, I think, is the 2-year program. A lot of people, especially on my floor, they go into nursing as a second career. So they'll already have a bachelor's in um for another degree, or they went to school for something else, they started working, they didn't like it, and they decided to become a nurse. So for those people, getting the 2-year degree made more sense for them because they already had their bachelor's. I went to a 4-year program just because I was coming out of high school, and it's what everyone else was doing, and it just made sense for me at the time, being 17, 18, to go for the 4-year program. There's different levels to nursing. I shouldn't say different levels, but there's different types of nursing. There's the RN, which is the registered nurse, and that's what I think what most people think of when they hear a nurse. Those are
mhm.
the people in the hospitals. They do the IV medications, med passes. They're not at the top, but they have a little more autonomy. And then below that is an LPN, and it depends a lot on which state you're practicing in on what LPNs can do and can't do. Some states you are allowed to, you're pretty much equal to a registered nurse. Some states you can't do certain things. So it all depends on where you're working.
I know that you're in a hospital setting. What other types of settings are an option, like private practice, other things?
There's so many, and I don't think it's really advertised how many different job opportunities you have as a nurse. You can work in a hospital, you can work in a doctor's office, you can work in a school, you can work in camps, on cruises. There's flight nurses where you transport patients on helicopters. And then even outside of bedside nursing, there's case management, there's telehealth nursing. So that's online. I know a lot of doctors' offices have started doing telehealth visits since the pandemic.
Mhm.
So they can work from home now.
Speaking of the pandemic, you were in school when that all, went down. How did that or did it at all impact your determination to continue pursuing nursing? Did it like scare you? Were you like, no, like this is motivating me, or did you not feel any specific way?
Um, I don't know. I don't really remember feeling any specific way. I think it was definitely a little scary at first.
Mhm.
Um, when everything shut down, I wasn't taking any nursing classes at that time. I'd taken all my nursing classes that fall of 2019, right before everything happened, and then spring of 2020 during that semester, I was taking general electives and um, random classes, like just the filler classes.
Mhm.
So it didn't affect my coursework that much. And then by the time I got back to school, we went back in the fall of 2020. It affected my mental health clinical. We weren't able to do that in person. It was a little strange,
Mhm.
because you're not working with real people, you're doing simulations.
Okay.
And looking back, mental health and those clinicals are so important because you encounter people with mental illnesses all the time in the hospital. Almost everyone has anxiety when they're in the hospital. It's a very stressful experience as a patient being in a hospital,
Mhm.
and having that clinical online, not really getting to experience that was hard.
Okay.
But I don't think it really affected my determination or anything to become a
Okay.
nurse. It was just, here I am, and we're just gonna roll with it.
Love that. That's the kind of attitude we need. So speaking of your work experience, can you tell me a little bit about what you do?
Yeah, so I'm a med-surg nurse, which it's a little bit of everything. We work with, we have patients have cardiac issues, neurological issues. So someone can come in with a stroke, they could come in with a fall, they could have ulcerative colitis. We have patients that have mental health issues. Schizophrenia is a big one, bipolar disorder.
Mhm.
It's a lot of everything. People come in after having surgery. If they go straight to the OR from the emergency room, after they're stabilized, they come to us. So we get all the stable patients that are in the hospital.
Okay. And is there a significant age range that you see, or does it tend to gear younger, older?
I've had a patient as young as 14 and a patient as old as 101.
God bless.
Yeah.
What aspect of your day-to-day work do you enjoy the most?
I think I just really like interacting with everyone. You meet so many different people. I've had people who are from Ireland. I've had people from all over the world. We get patients from different states that come to us, and they're all in different life stages. Some of
Mhm.
them have great advice on keeping relationships. I had one patient who was married to his wife for 75 years.
Oh,
So they're all, everyone's so different, and so nice to meet so many different people.
yeah. So that's just from like existing and like having been in a hospital or going to doctor's offices and stuff like that. I feel like having bedside manner can make or break a patient's experience in addition to, the healthcare that they receive. Was there any way in school that you were prepared to provide that kind of interaction? Because I've definitely had experiences with medical professionals where I was like, oh, you don't seem to enjoy this very much.
Yeah, I mean, you will always have a couple of bad apples. We had a lot of clinical experiences, which I really liked and was helpful in just interacting with patients. It's more something you learn on the job, though. Humanity in general, just being alive and being in this world, you talk to people, and I
Mhm.
don't think we don't take any classes to help with it.
Okay.
We talk about therapeutic education, and that's basically trying to talk to people in a respectful way. It's not a whole class or anything. I try to think of it as, you're dealing with people on some of the worst days of their life. No one likes being in the hospital, so you can't really take it personal. Someone could have just found out they have cancer, that their disease isn't curable, or they broke their hip and they may never be able to walk or run or do the same things again. So you just have to take everything they say with a grain of salt and know it's not personal. They just could be taking it out on you, even
Mhm.
if they don't mean it.
Now, So that must be hard to absorb, each and every day that you're working as a person yourself. Are there any techniques that you have or things you like to do to decompress or stay sane?
Um, I think what's nice about nursing is once I leave, I'm done. Even though I might still be thinking about all these patients, I don't have to bring any other work home with me. I don't have any physical work to do. So I can come home, I can watch TV, or I can go read. I usually get home pretty late, so I'm going to bed right away, especially if I have to be at work the next day.
Yeah.
So I just try to distract myself as much as I can.
Mhm. And now, kind of touching on scheduling, what did that look like? And I'm sure that's again different every scenario of nursing that you're in, but for yourself, how does the scheduling process work for your shifts?
I work 13 shifts a month usually. So we have a lot of autonomy on when we work. I shouldn't say we have a lot, but we do get to request which days we work. So 3 of the 4 weeks in a month, we have to do 3 shifts, and then the fourth week we have to do another shift. We have to work the fourth day to make it 13 shifts just to get um to balance it out to have technically 40 hours a week, because if you only work 3 shifts, you're only doing 36 hours a week.
Yeah.
So to be considered full time, you have to do 40. So they have to add in an extra one to make it equal. So we request which days we want to work each month. And for the most part, I feel I get those days. Every once in a while, you you have to be moved around a day or two just to fit staffing needs.
Mhm.
And then you also get to request which days you want off. So you can request specific days if you know you don't want to work a Friday or a Monday, which makes scheduling appointments and doing other stuff really easy because
Mhm.
I don't have to follow the 9 to 5 work schedule. I can make an appointment on a Tuesday at 10 o'clock and it's not going to affect my job.
Yeah, that's great. Now, when you graduated, can you tell me a little bit about like what your job search looked like in terms of how long it took to find a position and how you picked where you applied?
So when I graduated, I had to, like I said, take the NCLEX, the licensure exam first, and then I had to get my license from New York State, which, because I went to school out of the state that I wanted to work in, it took a little bit longer. So I took my NCLEX in August after graduating in May. Most colleges will recommend taking a little bit of time between graduation and taking the NCLEX to help study. Most people take the test in either July or August. And then I started looking for jobs, I want to say at the beginning of September. I think I found out that I passed the NCLEX September 1st or the very end of August. I interviewed with the hospital that I currently work at 2 weeks after I applied, and then they called me less than 24 hours after asking if I wanted to take the job.
And that's on picking a smart major.
Yeah.
um, that's awesome. In terms of like figuring out besides like location, is there how like colleges there's like I don't know if it's called niche anymore, but there's like a website that's like these are people's reviews of their experience like going to the school. Is there a version of that for like different medical places to work? Like, oh, I worked at X hospital and this was my experience, or is it really like word of mouth?
A lot of it is word of mouth. I'm sure there are some websites out there now. I think I did look on Glassdoor a little bit, and a couple comments came up about it, and they were all pretty positive.
Mhm.
And just interviewing with the managers for the floor, it seemed like a good fit.
That's awesome. And do you feel like there's anything else down the line in the world of nursing that you would like to try in terms of a different floor or specialty or an additional degree, anything like that?
Yeah, so grad school would give me a lot of opportunities. But even if someone doesn't want to go to grad school, there are more opportunities. There's case management. You can become a nurse manager, so you are basically running the unit. You do a lot of the scheduling, the office work behind it. But in terms of grad school, there's a couple of different options. The most common is becoming a nurse practitioner. They have a lot of the same abilities as doctors,
Mhm.
where they can prescribe medications, they can treat patients. Also, similar to LPNs and RNs, it depends on the state.
Okay.
In some states, you can own a practice by yourself and you don't need the oversight of a doctor. In New York, I believe you do need to have physician oversight. And the other one, which is what I'm more interested in, is the nurse anesthetist.
Okay.
So that also includes grad school, but you have to work in the ICU. Most places recommend at least 2 to 5 years of ICU experience.
Mhm.
And then you can go back to school. You can't work during school, which is also why you need a couple years before you can go because you have to save up a little bit of money. You have the same abilities as an anesthetist or
Okay.
anesthesiologist. So um, you give anesthesia to patients during surgeries. You can give epidurals. That's common with mothers having babies. You do the epidurals for labor.
Mhm. So we talked a little bit about like the different avenues that you can take in nursing, and it's not just your traditional hospital setting. I know because I'm gonna hit 30 soon. So a lot of people are doing like Botox and Dysport or whatever that's called. Do you see a trend in people going into aesthetic nursing as opposed to treating, I guess, health patients?
Yeah, I think lately a lot of different avenues have been opened up in nursing. Aesthetic nursing is a really big one where they'll go into private practice and they'll do that. My hospital actually just opened up an aesthetic clinic, I guess.
Okay.
So they're gonna start offering Botox and I think liposuction, a lot of those. Yeah, but like the cosmetic
There we
procedures.
go. Oh, I just hit the table. Um, yeah. No, that's funny. I live in an area where a lot of people have disposable income, and like that is just a really big, not liposuction, but like Botox and that stuff is a really big topic of conversation.
Yeah.
Um, and now I feel like people would feel more comfortable doing that in a hospital setting, but that's so strange that I don't know. It's a weird combo, I guess. Um, Okay, so ultimately, now that I've been rambling a little bit, I wanted to ask, do you have any advice for individuals who are interested in pursuing nursing? Maybe they're on the fence. Like what's a good way to determine if it might be the right fit for them? Because you can't really do like an internship per se unless you're in a program, I'm assuming. So um, it just seems like a field that you have to commit to once you start it.
Yeah, you do have to commit to it a little bit. I think um personality wise, you have to be someone who's willing to help others. You have to care for others, even if you don't always like the person. So if you can't really shut yourself off from your emotions, it can be a little bit difficult. But I definitely think people should try it. It's you have so many different options when it comes to nursing. You don't have to be that bedside nurse that everyone thinks of anymore. You can go into so many different opportunities where you can work from home, you can work in a hospital, you can work in an office. There's a lot of different ways you can be a nurse while still being a nurse.
Well, Katie, thank you so much for taking the time to talk to me today,
Thank you for
especially
having me.
yeah, especially since it seems like I've never spoken to a nurse before with the way I was asking questions. So, thanks for hanging in there, and yeah, that's it.
Thank you.